Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, RHONDA Brooks. It's Friday, September 19th. On today's HITshow, vaccine politics spark confusion inside the CDC's advisory committee, Seattle Children's announces more than 150 layoffs, and a wave of digital health funding sweeps across specialty care from neurology to maternal mental health. Plus, Imagine Pediatrics raises big money to transform care for children with special needs, and we'll close with an interview to hear directly from their team. All right, let's get started. We'll begin with a pretty tense meeting of the CDC's Vaccine Advisory Group. Peter Betterworth is on this one. Peter, what happened?
Yeah, Rhonda, this was honestly one of the most combative ACIP sessions I've ever covered. Martin Kulldorff, one of the Kennedy administration's new vaccine advisors, really lit things up. He said former CDC officials, quote, can't be trusted unless they agree to a public debate. And that just kind of cast a shadow over the entire meeting. Now, the committee did move ahead on some issues, like splitting the MMR and varicella vaccines for kids under 4 because of concerns about seizure risks with the combined dose. They also postponed a universal hepatitis B vote. But the scientific part was almost drowned out by the politics, with members openly confused about, what their role even is now.
So, Peter, that's not what we usually hear out of the ACIP. How big a deal is this shift?
It's a pretty big deal, Rhonda. Historically, the ACIP has been calm, technical, even a little boring, which in vaccine policy is actually good. But now, the public challenges, the contradictions, the infighting, it could really shake trust in vaccine guidance at a moment when uptake is already fragile. And states, schools, even insurers, they're all watching this closely.
Yeah, I see. That feels like it could ripple a long way. Thanks, Pete. Well, from policy tension to financial strain, Seattle Children's is cutting jobs. Teresa Vaughn has the story. Teresa, what's going on?
Well, Rhonda, they're laying off 154 employees, and the hospital points straight to federal funding cuts. And, this isn't just about one hospital. It's part of the broader wave of layoffs we've been tracking across the country. What stings here is that children's hospitals are so specialized. Executives are warning that unless reimbursements stabilize, they'll have to trim services just as demand for pediatric care is climbing.
Right. So, Teresa, how does this fit into the bigger layoff trend we're seeing in healthcare?
Well, it's really consistent. We're seeing systems of all sizes cutting back. But when a children's hospital makes cuts, the impact feels sharper because those are services that aren't easily replaced somewhere else.
I hear that. Thanks, Teresa. Still ahead, a funding wave in digital health from neurology to maternal care, plus a big acquisition in virtual primary care. Stay with us.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer.
You're listening to HITshow. Welcome back. Investors, it seems, haven't gone quiet at all. In fact, there's been a cluster of deals that really paint a picture of where digital health is heading. Nate Collier has the details. Nate?
That's right, Rhonda. 3 deals stood out this week. First, Bamboo Ventures and Innova are picking up Lemonade Health from 23andMe for $10 million. Lemonade used to be all about direct-to-consumer telehealth, but this sale is about consolidation. The new owners want to fold that infrastructure into a bigger digital-first strategy. Then, Savaro Health raised $39 million to expand its AI-powered virtual neurology platform. Neurology shortages are brutal, so the idea is that technology can triage and extend reach for specialists. And finally, 7 Starling secured $8 million for its maternal mental health platform. They're connecting new moms with counselors and peer groups virtually, and honestly, it's gaining traction fast.
Okay, so that's 3 very different deals, Nate. What ties them together?
Well, the common thread is focus. Investors aren't just spraying money at telehealth anymore. They're putting it into niche specialty areas where the need is undeniable: neurology, maternal health, and digital primary care. These are places where patients and payers are desperate for solutions, so the growth path is clearer.
Makes sense. So you're saying money's still flowing, but just more strategically?
Exactly, Rhonda. It's not about how broad you can go, it's about how specific you can be.
I see, yeah, thanks, Nate. Good stuff. And sticking with funding news for a moment, there's a big new round of funding in primary pediatric care. Anika Shah is following this.
RHONDA, Imagine Pediatrics just raised $67 million to expand their virtual first model for children with complex needs. Families with kids who have lifelong conditions often get stuck navigating fragmented systems. And this funding will let Imagine expand tech tools and home-based supports across more states.
So Anika, this puts them on a bigger stage nationally?
Yes, definitely. They'll be looking at Medicaid partnerships and scaling up fast. It's a big statement about the future of pediatric innovation.
Got it. Thanks, Anika. And finally, we wanted to bring in the voices behind Imagine Pediatrics themselves. Here's Voices reporter Jalen Cross with today's interview.
Thanks, Rhonda. I spoke with Imagine Pediatrics Chief Medical Officer Dr. Patricia Hayes to get a better understanding of their model and the way they care for children with complex health needs. These are kids who often see multiple specialists, and their parents are forced to balance fragmented care. Dr. Hayes told us that many families are overwhelmed, sometimes even carrying around binders just to keep their child's story straight.
We've spoken to families that tell us stories about just being exhausted going into another clinical scenario where they have to tell their story over again to somebody who doesn't know their child. They're shuttling between different appointments to people who may not know them. They may not be communicating amongst themselves as specialists, just because, again, this is a severely fragmented system with not enough interoperability for us to share information, and they just don't know where to turn to.
That frustration is what Imagine Pediatrics is trying to solve. Their model combines virtual first and in-home care, supported by a tech platform that gives families instant access to a multidisciplinary care team.
At Imagine Pediatrics, we care for children with special healthcare needs and medical complexity, and we do that through our virtual first and in-home care. These families really deserve to have a new form of access, and with our tech-enabled platforms, they can access care with Imagine Pediatrics just right at their fingertips within, less than a minute.
That new $67 million in funding will help expand these services and deepen partnerships with health systems, specialists, and primary care providers. The ultimate goal? Keeping kids healthy and at home whenever possible.
We really want to work in partnership with health systems and the specialists and primary care providers that are caring for these kids, because we want to help with the proactive piece in keeping these kids healthy and at home when they can be healthy and at home, and ensuring that when they're seeing their specialists and they're seeing their PCPs, they're set up for success already.
Rhonda, it's a model that blends technology with wraparound care. And with this new investment, Imagine Pediatrics is aiming to scale it nationwide.
Yeah, I see. That's a big infusion of capital with a clear mission attached. Very powerful. Thanks to Imagine Pediatrics for joining us to share their perspective. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, kimchi.com.